Hello, guys. Sometimes you might actually have shoulder pain, and you might wonder what could be going on in this shoulder. It could be bursitis, it could be rotator cuff syndrome, it could also be osteoarthritis, depending on your age. Especially if you've not had history of trauma, then and you're actually a younger adult, then you should, you know, you're less likely you're less likely to have osteoarthritis. But if you're an older adult or if you're a younger adult with a history of trauma, there is a high chance of you having osteoarthritis. Then what are you going to do? If you have any joint problem in your shoulder and there is no osteoarthritis, so if it's bursitis or rotator cuff or tendinopathy or tendinitis, then you can use ice, okay, in the early phase. But if it's osteoarthritis, please go for heat rather than ice. And then in this case of bursitis, tendinopathy or tendinitis, and also rotator cuff syndrome, you can try and use strengthening exercises, okay, depending on the area and the muscles in the muscles that are affected. And then if you are having osteoarthritis, then I think you should see a physiotherapist, because your physiotherapist is going to consider if there is limitation in your joint, and maybe starting from improving range of motion will be very important. So your physiotherapist could actually try to start from giving you gentle stretching exercises to improve your range of motion, and then also to reduce pain, and before going into any other kind of training like strengthening or endurance training and all whatnot. So if you have osteoarthritis, try and see your physiotherapist. If you have rotator cuff syndrome or bursitis or tendinopathy or tendinitis, you have to do strengthening exercise. And now this is for younger adults. Can it happen in older adults? Of course, they could also have all these conditions at once. So in summary, please see your physiotherapist for proper diagnosis and proper management. I hope this helps someone out there. Try and use ice or heat, depending on what you have. Go for strengthening exercises. Don't stop moving your shoulder unless you have fracture or maybe you've had trauma. So the end point is see your physiotherapist today. Okay, guys, I'll be waiting for your questions in the comment section, and also to address any concerns you might have, or any questions to address clarity you might have in the comment section. Please do well to share with someone out there. It could help someone out there, right? Okay, guys, more love and care from Pocket Physio Tips. Take care of yourselves. Bye.